Plenty of people took issue with my interview last week with a doctor from Idaho who legitimized the hesitancy people are currently experiencing with the COVID-19 vaccine. He said that he is not getting the vaccine based on the premise that he doesn't trust how quickly it came out at this point. He says, like many people who are hesitant, he would like more time to see results in those who have already been vaccinated. Doctors here in the Land of Mayo Clinic shared this viewpoint, but many will not go on camera saying so for fear of professional backlash. Medical correspondent for ABC News, Dr. Jen Ashton, joins me. We are talking about the latest with COVID-19, the vaccine, and the hesitancy is where I wanted to start, Dr. Jen. Does taking a wait-and-see attitude go against science?
Well, I think it does. And first of all, let's back up. I want to say that for any practicing clinician, this process of counseling and providing information and informed consent and educating patients about benefits versus risks is something that we literally do every day. And for me personally, that's a process that starts with respect, respecting the questions, the concerns, the fears, all of that comes with it and needs to be addressed first. What that does not mean, however, is that we should throw scientific data and evidence out the window in the setting of a public health emergency and crisis. And right now, we have to go by evidence and not emotion, and facts and not fear. And those facts tell us, based on clinical trials and now millions and millions of people who have been vaccinated, that not only are these vaccines incredibly effective, but they are safe. I got my first dose in December. Still here, nothing's happened to me. I haven't grown a third arm. And I think that we need to understand that it's normal to be afraid, it's normal to ask questions, and it's appropriate to ask questions, but we have to go by facts here. And I think that if people do that, they can really much more readily evaluate risk versus benefits and make the right decision for themselves and for their families.
Beautifully put. I do love your perspective on this. Why is it that those, though, who are hesitant are considered the ones who need to be educated? Because I've talked to plenty of people who are very well educated who have that hesitancy. And like you mentioned, you respect the people who have questions. Dr. Fauci just recently saying the same thing. Does that mean then that people who haven't been vaccinated or have that hesitancy are less educated?
Clinical trial data is publicly available. It's fully transparent. You can read those clinical trials, the methodology and the data analysis. I've read them, certainly for Pfizer and Moderna, and anyone can read them. But understand that when you look at that data, if you still don't believe it, based on the facts in front of you, then you're not really making a decision based on facts. You're making it based on fear and emotion. And if we really acted every single day in our lives based on fear and emotion, I wouldn't get into a car. I wouldn't get into an airplane. I would never have had 2 babies because there are real risks with pregnancy. So I think that's how we have to make a decision. What's the risk of getting it? What's the risk of not getting it? What are the benefits of getting the vaccine? And what are the benefits of not getting it? And right now, there really is no benefit to not getting it. And not only do you risk your own health, but you literally endanger and risk the health of those around you. And I think that this is an important situation that people really need to take their time and make the right decision with.
And a very important as well discussion, hearing your viewpoint, which we hear so much from public health officials as well. Now we have the 16 and older age group being able to get vaccinated. A lot of teenagers are. When it comes to parents who sit on different sides of this issue, in comes the emotion. It creates some family conflict. What do you say to parents?
Well, first, people ask me all the time because I am a mother of 2 children in college, and they were both vaccinated as soon as they were eligible and it was made available through their jobs, actually, because one is taking the year off from college. And I would never take a chance with my own children, just like I wouldn't take a chance with my own health. So I think that, again, parents are used to weighing these decisions, making these decisions on a regular basis. But we have to understand that in the setting of a pandemic, with what we've seen go on in the last year and 3 months, we don't have a lot of time to wait and waste in making these decisions. So we have to go to credible sources and, again, stick with the science, what's known, as well as what's not known, but we have to let that guide us, because this is, as we're seeing play out in India, a global health emergency and one that we need to take very seriously.
ABC medical correspondent, Dr. Jen Ashton, love always getting your insight on anything health related. I appreciate you.
Thank you so much for having me.